Welcome back. I'm nurse educator Chelsea, and today we're going to be talking about cardiomyopathy. Cardiomyopathy is a disease of the heart muscle that can make it harder for the heart to pump blood to the rest of the body and could potentially lead to heart failure. Today I'm going to be discussing cardiomyopathy as it is related to adults, but it can also affect children. Symptoms of cardiomyopathy include shortness of breath, fatigue, swelling in the lower extremities, difficulties breathing when lying flat, chest pain or pressure, arrhythmias or palpitations, or heart murmurs. There are several risk factors that can contribute to cardiomyopathy. These can include having a family history of cardiomyopathy, heart failure or sudden cardiac arrest, having an individual history of coronary artery disease or heart attack. Other risk factors can include chronic untreated hypertension, pregnancy, obesity, chronic alcohol abuse, use of drugs such as cocaine, amphetamines, or anabolic steroids, history of infection of the heart, diabetes, thyroid disease, amyloidosis, sarcoidosis, or any connective tissue disorder. There are different types of cardiomyopathy. I'm going to be discussing 6 of the most common types of cardiomyopathy here. First is dilated cardiomyopathy, where the ventricles or bottom chambers of the heart become thin and stretched and become enlarged or dilated. The second type is hypertrophic cardiomyopathy. This is when the heart muscle thickens or becomes hypertrophied. The third type is restrictive cardiomyopathy. This is when the ventricles stiffen and reduce blood flow in the heart. The next type is Takotsubo's cardiomyopathy, otherwise known as broken heart syndrome. This is a result of severe physical or emotional stress, possibly the result of a surge of stress hormones. It happens almost exclusively in women and typically resolves within 1 month. The fifth type is chemotherapy-induced cardiomyopathy. This is heart damage related to cardiotoxicity related to chemotherapy drugs. And the last type is peripartum cardiomyopathy. And this happens when the heart muscle becomes weak and larger than normal during the last trimester of pregnancy or up to 6 months after delivery. Testing for cardiomyopathy can include doing an electrocardiogram or EKG, an echocardiogram, stress testing, cardiac catheterization, or ambulatory cardiac monitoring, which could include a Holter monitor, a Zio patch, or an implanted loop recorder. Testing that is less commonly utilized is myocardial biopsy, cardiac CT, or genetic screening and testing. Goals of treatment for cardiomyopathy usually include managing signs and symptoms, preventing the condition from worsening, and reducing the risk of complications. Treatments can include medications, procedures, external or internally implanted devices, surgery, and lifestyle modification. There is no cure for cardiomyopathy, but it is manageable and usually has a slow progression. Medications can be used to improve the heart's ability to pump blood, lower blood pressure, improve blood flow, slow heart rate, prevent blood clots, or remove extra fluid from the body. These medications can include anticoagulants, beta blockers, ACE inhibitors, antihypertensives, diuretics, antiarrhythmic medications, or statins. Procedures that can be done to treat cardiomyopathy include cardiac catheterization or cardiac ablation. So, cardiac catheterization can be done to identify and treat coronary stenosis or blockages, and ablations can be done to control cardiac arrhythmias or decrease the size of the heart muscle. Devices that can be used to treat cardiomyopathy include an external wearable cardiac defibrillator, such as a life vest, and then at some point they may receive an implanted pacemaker or AICD to control arrhythmias. In some cases, a left ventricular assist device can also be used. Surgery may also be considered to treat cardiomyopathy. A CABG or coronary artery bypass grafting may be considered if there are heart blockages that need to be addressed. And in some cases, a heart transplant can be considered when all the other treatments have failed to manage symptoms. Lastly, patients can adopt lifestyle modifications to improve their symptoms of cardiomyopathy. This can include eating a heart-healthy diet, limiting salt intake, exercising regularly, limiting alcohol intake, managing and reducing stress, quitting smoking, and weight loss if the individual happens to be overweight or obese. Thank you for coming to learn with me today. Please remember to rate, review, and subscribe to get the latest updates on my channel.